20 plus preventive services covered under Medicare Part B. Wow, that's a lot. Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. Welcome. Today's video, we're going to answer that question and go over the long list. If you're new to our channel, watching for the first time, don't forget to subscribe, hit the little bell so you get future notifications when we release new videos, which is about twice a month. Tell your family and friends, and don't forget to give us a thumbs up. Now, on to today's video, 20 plus preventative services covered by Medicare. I had done a video saying all the things that aren't covered by Medicare, but there's a lot of things covered by Medicare. So let's go over this. Now, I'm going to tell you where to find this list because I know some of you are not going to wait till the end of the video, even though my videos are relatively short and I try to keep them under 10 minutes. But all of this is listed in the Medicare and YOU guide, which we will make available here. And I'm going to show you exactly how to find each and every one of these things. So watch this. Okay, here we have the Medicare and YOU guide. This is a big, long document. This is for 2024. It's published by CMS. They update it every year, Centers for Medicare and Medicaid. It's 128 pages long, which is ginormous. And but they have this handy tool. This is a PDF. You'll see this little magnifying glass up here. If I click on this, I'm able to search for keywords. So if I type in preventative, which is the word I often use, nothing comes up, no matches. And that I thought that's not right because I know they cover preventive. So preventative. But I found on page 3, the word that the government uses is preventive. And I thought, what's the difference? Preventative and preventive, aren't they the same thing? I didn't know, so I used my friend Google to find out. And Google said, I typed in preventive versus preventative, and it says there is no difference. They're both adjectives used to mean the same thing. And the meaning is to stop something bad from happening. So there you go. The government uses preventive, and I'm probably going to say preventative 10 times in this video. So be forewarned. Preventive. So the first thing that comes up when I hit enter and I use this word is page 3 is the symbol key. And it shows us that there's an apple symbol whenever you have a preventative service listed. Now I can keep scrolling. If I hit enter over and over again, it's going to show me and highlight all the pages where the word preventative appears. So this is the index, and it's showing the screenings are on page 11. You know, there's a whole list of screenings. If I keep hitting enter, it mentions screening, shots, vaccines, and the wellness visit. If I keep hitting enter, I will go to eventually the next time it's highlighted. Maybe not. Let's see, try this again. Here we go. What does Part B cover? It covers preventative services. And you'll see they actually list page 30 to 55 is all the Part B services that are covered. Now, if I scroll down, I will see that how this is paid. What it says is you pay nothing for most covered preventative services if you get the service from a doctor or other qualified healthcare provider who accepts assignment. However, for some preventative services, you may have to pay a deductible, coinsurance, or both. These costs may also apply if you get a preventative service in the same visit as a non-preventative. So this is about as clear as mud. You may pay nothing, but you could pay something. So just be forewarned. It depends. So if I keep hitting enter on the preventative, oh, here we go. We're starting with the page 30. This is all the services, well, a summary of the services under Part B, right? And if I scroll down, you'll see they start alphabetically with A, and it continues to page 55. The very first thing that comes up, we see this little apple here, right? And it's abdominal aortic aneurysm screenings. That's a mouthful. You'll notice a lot of these preventive services use the terminology if you're at risk and only with a referral from a doctor. So, you know, if your family has a history of these things and the doctor recommends it, it's going to be covered by Medicare. So there's the first one. So abdominal aortic aneurysms, I don't know how many people suffer from that, but if I keep hitting enter, then I see the next one, alcohol misuse screenings. Bone mass, that's very common in women, cardiovascular, cervical cancer. So that's how you find all the things that are listed under preventative, and they're listed right here in the Medicare and YOU guide. Okay, so now you know how to find it in the guide, and we just went over the top 3 or 4 things, right? Number 1 was abdominal aortic aneurysm screening. Number 2 was alcohol misuse screenings and counseling. Number 3 was bone mass measurements. And, this is very common, osteoporosis in women and men of older ages. So the screenings are covered for those things. Number 4, cardiovascular behavior and behavior therapy and disease screening. They're actually listed as 2 different things in the guide, but I kind of lumped them together under one. Number 5, cervical and vaginal cancer screening. What is this? This is Pap's test, right? Pap smears. We are all familiar with that. Women do this. Now, at a certain age, they do change the guidelines, and if you're over 65, I believe it's every 24 months. Please reference the guide, but it says every 24 months, unless you're at high risk. So then they will cover it more often if you are at high risk. It also, under the same kind of area, is human papilloma virus. Papilloma virus. Somebody's going to get me on the pronunciation, but HPV, that is also covered, and it says in the guide you pay nothing, right? Number 6, colorectal cancer screening. What are we talking about? Colonoscopies. So you want to look in the guide because it does go over how often these are covered, and it's kind of a long description, so I'm going to reference the guide, but I tell you a quick story. They do cover this, and you do need to prep for them. And I heard a story from another agent, it wasn't one of my clients, where the guy had to get a second test because he didn't prep properly. And so the second test wasn't covered, or it wasn't free, okay? What happened was he didn't take all the fun stuff you have to drink to clean your system out. When the doctor went in there, it was all murky. They couldn't see if there were polyps, and so and that was the fault of the patient. So they do cover it. You do need to properly prep, just so you know. It's not fun, but anyways, that is number 6. Number 7, counseling for tobacco use or tobacco disease. Number 8, COVID vaccines, right? We all know about that. Number 9, depression screenings, very important. A lot of older people are depressed. People are dying. They may not be able to do as much as they used to do. And especially if they lose a spouse or their life changes, they have to give up their house, move to a retirement community. It is not uncommon for seniors to experience depression, and it's very important to get screened. Number 10, diabetic, is that the right word? Screening for diabetes. Okay. Number 11, flu shots. Number 12, glaucoma screenings. I'm going pretty quick here. Number 13, hepatitis B shots and screenings. And by the way, under the same categories, hepatitis C. They list them separately in the guide, but we'll lump them together to make it shorter. A shorter list: 14, HIV screening, 15, lung cancer screening, 16, mammograms. Okay, they cover pap smears, they cover mammograms. Now, this is once every 12 months. It's a baseline mammogram. So, there is a specific kind, and it can be covered more often if it's diagnostic in nature, but it may be subject to the deductible and copays. Okay. Number 17, nutritional therapy services. Number 18, Medicare diabetes prevention program. So I don't know when this was added, but they came up with their own program, and it's once per lifetime, and it's really to prevent type 2 diabetes. So usually type 2 is adult onset, right? Type 1 is child. And so people that have high sugar or pre-diabetic, they want to give them counseling to make sure they don't become diabetic. So once in a lifetime, that's covered, number 18. Number 19, obesity behavior therapy. So if your BMI is 30 or more, that's considered obese under our guidelines, and they do counseling or therapy for that. Now, note, there is an update. I had a lot of comments in another one of my videos. They should cover these weight loss drugs. CMS is looking at this, and they are taking a look at certain types of people with high risk and heart conditions, and they will be covering some of these medications. I will probably do a future video on that and give you more updates, but I just want you to know that it's on their radar. So that's good news. Number 20, pneumococcal shots. Another fun word to say. Basically what this is to prevent this type of infection, which is a common type of or a certain type of pneumonia. So it's pneumonia, right? Pneumococcal. Anyway, say that 5 times fast. Number 21, prostate screening, right? So for women, we have pap smears and mammograms, and for the men, we have prostate. Very important, and you want to catch it early, and you should do these on a regular basis. Number 22, sexually transmitted disease and screenings. And last but not least, 23, welcome to Medicare preventative visit. Now, if you look in the guide, you'll know that this welcome to Medicare visit is done the first 12 months you get on Medicare Part B, okay? And they do go over a list of things. I'm going to tell you to reference the guide there. And then on an annual basis, it's really not called preventative, it's called an annual wellness visit. It's a little bit different. I know the terminology is strange, but those are the 20 plus things that are preventative or preventive, whichever word you use, are covered by Medicare. We hope you enjoyed this videos. Thanks for watching, and until next time, this is Kathy Bukowski, the owner of CB Health Insurance.